name's Allison. I will be your student nurse today. Can I get your name and birthday, please? Okay, great. And I'm looking at his armband, and that matches exactly what I have in my computer. I will be giving you, sir, your ceftriaxone, which is an antibiotic for your infection. I will be giving you this injection through your running IV. And I did check for any allergies that you have. There are no allergies. Are there any allergies that you need to tell me about that you have? No? Great. All right. So we don't have any complications with that. And I also did check if this medication is compatible with what is running, and it is compatible. If it were not compatible, we have two options. One being that, so we could pause our IV pump, and then actually disconnect the port, and then I would push that medication through essentially through a saline lock, so I would do that, and then I would also need to put a 24 intermittent tubing label on that, on the IV, or on the tubing, and that would need to be changed within 24 hours. So we could do that, or we could hit pause, close our roller clamp, clean off our port for that 15 seconds, and flush with 10 milliliters before, give our medication, and flush with 10 milliliters after at the same rate, and then go ahead and restart, unclamp, and then go through. But like I said, it is compatible, so we are good to go. Let me get some gloves on here. All right. So first I want to inspect the IV site, so that I don't see any swelling. There's no warmness, I should say no heat. There is no pallor. Sir, is there any tenderness or pain? No? Okay, he's good. And I am just ensuring, okay, it's running, we've got a drip, and so I want to follow this line all the way to the patient's arm, and we will be giving the medication through the closest port to the patient. Okay. So, I'm going to take our alcohol pad. We're going to clean off this port for 15 seconds using friction. Going to allow that to dry for 10. And as I explained to the patient, we've got our ceftriaxone, which is an antibiotic. It's going to kill any infection that he has going on. We've got 2 grams in 20 milliliters of fluid. I've checked the patient's name, birthday, the date, the time that it should be given, and the expiration date. So we are all good with that. Let me take that cap off. And this medication can be given over 1 to 4 minutes. I have chosen 2 minutes, which means that I can give 2.5 milliliters every 15 seconds. So I'm ensuring that we get all the air out, which we do. Okay. I'm going to attach this to my port. And while I am pushing this med, we're going to be using a push-pinch method. I'm taking my line, so let's see, okay, so 2.5 milliliters over 15 seconds. So we're pinching while we're pushing, okay, and release, pinch. Okay, we want to be asking the patient, are you having any discomfort? Is there any burning? He told me no, there's not, so that's good. Never want to just push a med, because that will create lots of discomfort for the patient, a lot more chance for adverse side effects. Again, just continuing with that pinch and release motion. Okay, so now we've got all of our medication in our line. Disconnect that, dispose of that. Get ourselves another alcohol pad. Clean that port off for another 15 seconds. Using friction. Okay. And then we are going to do one last flush of 2 milliliters while that's drying. We want to make sure to do this flush because in this little chamber here, there can actually still be some medicine. So the next time something gets pushed through, we don't want this patient to all of a sudden get this medicine as a bolus. So that has now dried. Let me take this off. Making sure to get any air out of our flush. Okay. Alright. It's dried. I'm going to attach, and we'll be giving this flush at the same rate as we did our medicine. So we only have 2, but we'll give it at the 15 seconds. Because if you remember, we gave 2.5 over 15 seconds. So we'll do the same with this flush. Okay. Maybe one last alcohol wipe here for 15 seconds. Okay. Using that friction. Okay. All right. Removing my gloves, getting rid of all my stuff here, my garbage, performing hand hygiene. I will now document my findings and what I just administered, and I will return to the patient in about 15 minutes and check on that site and see how he's doing.